I would like you to meet a couple of doctors who are doing a really good thing. They are donating life-changing surgery to two people in the Portland area. Dr. Brandon Rehrer is here. Hello, Dr. Rehrer.
Hello.
And Dr. Russell Lieblick is here as well. Hello, Dr. Lieblick.
Good morning.
Before we find out what you're doing, tell us about your specialty.
Oral maxillofacial surgery is a specific nature of dentistry that focuses on the face and up. Essentially, we perform jaw surgeries to correct malformations in your bite. We take out teeth and we place dental implants to replace missing teeth.
And you gentlemen share a practice, the same clinic. What is the name?
It's Beacon Oral and Maxillofacial Surgeons, and we have 4 locations, and we tend to rotate around, but we're partners in the practice.
Okay, we'll find out more about that in a second. I want to find out about your project. You decided to donate surgery. How did that come about?
Well, it came about over a number of years, and about 6 months ago, we finally decided that there's such a need for this type of changeover or makeover for a number of patients that it was time that we needed to do something for those that really couldn't afford the treatment.
And you ended up selecting 2 people out of a number who submitted applications.
Yes, we had over 120 applications to the process, and really we only announced it over Facebook and social media, and over 120 applicants. And then we saw on the day of really consults, over 70 individuals came in, and talk about difficult to narrow down was not an easy process, and we feel like the receiving recipients are great candidates.
Now, tell me what you can about each one. Let's start with the first one you selected. That would be Jacqueline from Clackamas.
Jacqueline Currency, she's an individual that really has an unfortunate story. She is a beautiful young lady that was suffering from different type of medical issues, and she ended up losing her teeth, and really prematurely. And then she was unable to even get a denture because she had so much extra bone that the previous dentist who extracted her teeth didn't perform it adequately. And so she really was left disabled with no teeth and no process or even ability to get teeth. And so for the last close to a year and a half, she's been without teeth. And so, as everybody knows, it's difficult to smile, it's difficult to eat, it's difficult to meet people without having a smile. And so she's been severely disabled in all seriousness.
And what are you going to be able to do for her?
Well, the beautiful part about this is that she'll be able to come to the office. She'll go to sleep, and in a few hours' time, in cooperation with the dentist that we're going to work with, she'll have dental implants placed and brand new teeth placed in. She'll wake up with new teeth.
Oh, that's going to be, as we said, life-changing.
Absolutely.
Now, tell me about the other patient, Christina from St. Helens.
Christina is an amazing woman. She has a beautiful family, and she is just disabled because she's so embarrassed by her smile and her ability to communicate, and it's caused family problems between she and her daughter with their relationship because she's just mortified by her appearance. And even in talking to her on a really casual basis, she continually hides her smile, and it causes problems in her professional life. And so we're just so excited that we'll be able to make a changeover for her, and so that she can proceed with normal relationships with her family and in her professional life.
So what will her surgery consist of? What will you be doing for her?
Well, it's very similar. She has some teeth that are unattractive, and we'll be removing her teeth and at the same time placing her dental implants, and she'll go to sleep in our office and wake up with brand new teeth as well.
With brand new teeth, a brand new life. You gentlemen are both gifted surgeons. Tell me what made you want to do this. This is such an act of generosity. You don't hear about this.
Well, I think each of us have had a sense of community, and as we treat the patients in our communities in each of the prospective offices, we have people who come in and would like to have dental implants but couldn't afford it. And so, Russ and I began to talk about having an opportunity to give back. And we didn't want to just do 1 implant, 2 implants. We wanted to pick individuals that really would change their lives, because the program is to help really change their lives for the better, professionally, personally, and really their confidence. Because even after the recipients were chosen, I felt like you could see their shoulders stand up a little bit more. They sat back. They tried to smile a little bit more. And for us, that was a great indication that this is a part about really providing an opportunity for individuals to change their lives and make it better.
It's a cooperative process. It's not just us. It's the dentists that are involved as well. And the really beautiful part about this is that it wasn't just us reaching out and saying we're gonna change somebody's life. We had to reach out to the dentists that we work with, and it was amazing. It's a huge ask for us to say, hey, would you be willing to donate your services as well? It takes a lot of time in the office, and it takes a lot of expense on their part. And they, to a person, all said, absolutely, we would love to be a part of the program. And it's just amazing, the dental community that we work with, the expertise that they have, and then being willing and able to donate those services is unbelievable.
So who are your collaborators?
Well, initially we had to ask 5 different dentists to volunteer for this, because we work in a large geographical area, and we needed to have dentists that were somewhat local or accessible to the patients. And those were Dr. Albert Canepa up in Vancouver, Camas area, Dr. Stan Bonstedt, Dr. Aaron Tinkle, Dr. Mark Kyleman in the Dalles, and Dr. R.B. Cook in the Dalles. And the 2 that are actually going to be working with us for these 2 are Dr. Aaron Tinkle and Dr. Stan Bonstedt, who are extremely talented and very educated experts in this type of treatment.
All those, we were grateful because we just didn't have to ask them. They volunteered. They were more than happy to be part of this process because, again, like us, they wanted to help the community and give back.
And finally, tell me about your practice, the name again of the practice. What is your website? I hear there's a video of this on the website. And what kind of problems do you help people with?
Our name of the practice is Beacon Oral Maxillofacial Surgeons, and our website is beaconoms.com. And on there it talks about the Second Chance program, and there's a video that kind of indicates what each of the recipients and the process of the application and the announcement. And for us, we focus on dental implants. We focus on extracting teeth, wisdom teeth, and then jaw surgery for those individuals who have a bad bite, and then we can correct that to, again, get them back to function.
Our practice is built in the specialty of oral and maxillofacial surgery, which includes all the things that Dr. Rehrer included, and as well as cysts and tumors of the jaw and other pathology type items. And for this especially, there's a cooperative process with the dentists that we work with.
Okay, Dr. Brandon Rehrer, Dr. Russell Lieblick, thank you both.
Thank you.
Thank you, John.
For having us.